Hello, and thank you for your time today. My name is Susan Tracy. I graduated with a Bachelor's of Science in Nursing from Mennonite College of Nursing at Illinois State University in 2011. I then went to work as a registered nurse in the emergency department and obstetric unit at a critical access hospital in central Illinois. I am currently the emergency response coordinator and health educator at the Logan County Department of Public Health in Lincoln, Illinois. I am due to complete my Master's of Science in Nursing from Benedictine University at the end of June. Today I will be presenting on my capstone project, Preparing Public Health Nurses for Disaster Preparedness, Response, and Recovery. With disasters occurring more frequently around the world, the need to prepare nurses for disasters has never been greater. The public health workforce has become a frontline first responder, and this additional role has added a new layer to public health response activities. More than 80% of nurses who volunteered to serve for a disaster event had no previous experience in disaster response. Through education and training, nurses can be equipped with the competencies required to prepare for, respond to, and recover from disasters. Disasters cause an interruption in healthcare delivery, destruction of infrastructure, injury, suffering, and the loss of life. Disasters are unpredictable and can occur at any moment, so preparedness is crucial. Public health nurses have unique skill sets that bring critical expertise to each phase of the disaster cycle. Public health nurses' abilities are critical for population-based care across the disaster cycle. However, public health nurses are frustrated at the lack of clearly defined role and educational training to respond effectively to disasters. Nurses need to be knowledgeable about the role they play and the training needed to respond to emergency events. Public health nurses should possess a minimum knowledge base, skills, and abilities regarding disasters and public health emergency preparedness, and must be able to respond directly or provide indirect support in any type of disaster event or public health emergency. This vision is predicated upon the belief that public health nurses who possess at least a minimum knowledge base and skill set are better able to keep themselves and their patients, families, and communities safe, or at least to minimize the harm that may occur, and will ultimately lead to communities that are more resilient to disasters. When public health nurses do not have clearly identified roles, this can cause confusion, potential injury to victims of disasters, and an uncoordinated disaster response. To achieve the goals of disaster nursing, all public health nurses must meet core competencies necessary to provide holistic care to affected populations. Ensuring that public health nurses achieve a certain level of competence in their practice is important both to safeguard the public and enhance nurses' effectiveness at achieving optimal population health outcomes. Today's disasters and emergencies are complex, and the need for disaster education must be incorporated into workforce development so that public health nurses know what to do and how to respond during disasters or emergencies. When public health nurses have a better understanding of their roles during disaster preparedness, they can better address the needs of the population. The two themes identified in the literature include education, training, and experience in disasters improves nurses' disaster knowledge, skills, and abilities, and disaster core competencies are needed to guide nursing education. The Quad Council of Public Health Nursing Organizations, comprised of the Association of Community Health Nurse Educators, the Association of State and Territorial Directors of Nursing, the American Public Health Association Public Health Nursing Section, and the American Nurses Association's Congress on Nursing Practice and Economics, was founded in the early 1980s to address priorities for public health nursing education, practice, leadership, and research, and is the voice for public health nursing. The community public health nursing competencies developed by the Quad Council provide the curriculum framework necessary to design an educational course that focuses on the knowledge, skills, and competencies required for public health nurses in disaster preparedness, response, and recovery. The Quad Council describes 60 community public health nursing competencies organized within 8 domains or skill sets: assessment and analytical skills, policy development, program planning skills, communication skills, cultural competency skills, community dimensions of practice skills, public health sciences skills, financial planning and management skills, and leadership and systems thinking skills. Competencies were selected from each of the 8 domains and were used to inform the content of the project to ensure public health nurses are receiving competency-based continuing education. As a result of the implementation of the evidence-based educational workshop for public health nurses, a standardized evidence-based workshop curriculum was established and will be utilized by the Illinois Department of Public Health to train public health nurses at the local health departments in the state of Illinois. Public health nurses that participated in the evidence-based educational workshop will have an increased level of competence in disaster preparedness, response, and recovery as determined by the program post-evaluation, thus increasing the nurse's scope of competent practice. And finally, community preparedness and resiliency will be increased through increased competency of public health nurses to prepare for, respond to, and recover from disasters, as evidenced by post-workshop evaluations. Preparing public health nurses in disaster preparedness, response, and recovery was implemented at the Kankakee County Health Department in Kankakee, Illinois on May 18, 2018. This interactive workshop for public health nurses utilized active learning strategies to develop knowledge, skills, and abilities related to disaster preparedness, response, and recovery. During the workshop, learners worked as a team to identify the relationship between the nursing process and the disaster management cycle, developed a rapid assessment tool to determine access and functional needs of shelter occupants, and evaluated ethical and legal dilemmas that can arise during disasters. Learner-centered objectives were developed based on Bloom's revised taxonomy. The objectives are: at the end of this workshop, learners will be able to, first, select the appropriate phase of the disaster management cycle and step in the nursing process, given an example of a public health nursing action. This objective is at the level of analyze. Second, evaluate ethical and legal dilemmas during disasters. This objective is at the level of evaluate. And finally, create a rapid assessment tool based on the CMIST framework for access and functional needs. This objective is at the highest level of Bloom's taxonomy, create. For the first teaching strategy, the learners worked as a team to complete a chart. The learners were given examples of nursing actions. Each example was from one of the following steps in the nursing process: assessment, planning, implementation, and evaluation. Each example fits in one of the disaster management cycle steps: preparedness, response, and recovery. The learners worked as a group to determine which step in the nursing process each example described, and then determined which step of the disaster cycle it represented. A large chart was used to compile all of the examples. This strategy promoted active engagement, teamwork, collaboration, communication, and critical thinking. The second teaching strategy included the development of a rapid assessment tool. Learners were divided into groups of 2 or 3. Each group was given the information about the CMIST framework and were required to develop a rapid assessment tool that they felt organized the information in a manner to assist in the assessment process. Each group then shared their tool with the rest of the group, describing how and why they developed the final tool. This strategy promoted critical thinking, teamwork, collaboration, communication, and reflective learning. The third and final teaching strategy included case studies that required critical thinking and group discussion. A YouTube video entitled "Katrina: Nursing Nature at its Worst, Nursing at its Best" was played prior to completion of the case studies. A discussion was led based on different perspectives of the same disaster as presented in the case studies and the video. Kirkpatrick's model has served as the primary organizing design for evaluating training programs for the past 40 years. Kirkpatrick's evaluation strategies represent one of the most comprehensive strategies for evaluating training programs. This model comprises 4 essential levels of evaluation, and each level has an impact on the next level. A blended evaluation approach was utilized to evaluate project outcomes, learner-centered objectives, the educational offering, and the instructor. An approach in which multiple levels are evaluated from numerous perspectives is a way to maximize data while minimizing resources. A blended evaluation form was developed that included all dimensions of Level 1, questions about confidence and commitment to apply what was learned on the job, and questions related to anticipated application and outcomes. Statements were chosen to determine if learner-centered objectives were met following Kirkpatrick's model. Learner-centered objectives were evaluated utilizing the evaluation form and participant feedback. Based on participant feedback, learner-centered objectives were met with this educational offering. Statements to evaluate the educational offering were chosen based on Kirkpatrick's model. The educational offering was evaluated utilizing the evaluation form and participant feedback. Participant feedback was very positive regarding the educational offering. Statements to evaluate the instructor were chosen following Kirkpatrick's model. The instructor was evaluated utilizing the evaluation form and participant feedback. Participant feedback was very positive regarding the instructor. Specific statements were chosen to determine if program outcomes were met following Kirkpatrick's model. Project outcomes were evaluated utilizing the evaluation form and participant feedback. The participant responses showed that, with increased competency and a commitment to apply the information learned, project outcomes were met. Project sustainability would be possible, however, there is no particular person within the state responsible for preparing public health nurses for disasters. This responsibility falls on each local health department. The majority of health departments within the state are working with minimal staff, therefore the likelihood of implementation and sustainability of this project is not high. The past 20 years has shown a dramatic increase in the frequency and intensity of natural, weather-related, technological, infectious disease, and human-caused disaster events, making it imperative that nurses, the largest healthcare workforce, are competent in their role in the disaster management cycle. Public health nurses have specific skill sets that bring critical expertise to the disaster management cycle. Public health nurses' abilities are critical for population-based care across the disaster cycle, and they are knowledgeable about the diverse community resources that are available, as well as what gaps may exist in community services before, during, and after a disaster. Despite this, many public health nurses continue to report a lack of preparedness for disasters and a lack of confidence in responding to a major disaster event. Through the utilization of evidence-based educational opportunities, public health nurses can enhance their knowledge, skills, and abilities related to their role in disaster preparedness, response, and recovery. Throughout the process of developing and implementing this capstone project, I learned a great deal about my strengths and weaknesses. I am a fast learner, and this proved helpful in the development and implementation of this project. I had to reach out of my comfort zone and contact people and departments that I was unfamiliar with. However, because of this, I had the opportunity to meet and collaborate with a wide variety of professionals who all have a desire to further public health. I have developed a deeper knowledge base and understanding of public health nursing and disaster preparedness. Developing active learning strategies to support learning outcomes allowed me to grow in my understanding of the role of the nurse educator. These skills will be invaluable as I move forward in my career as a nurse educator. Here is a list of the references used in this presentation. Thank you again for your time today.